as usual. I don't know what day it is, but today basically I want to talk about maintaining um your sort of condition stability in a way for jaw surgery. Firstly, I need to address. Anyway, let me show you my swelling first. This is my swelling. I don't know what you think. Okay, so this is my swelling. This part seems to have gone down a bit. Okay, which is quite nice, but I'm still feeling a bit numb here. And when I brush my teeth, I can't actually feel my upper jaw. So yeah. But I do like how my nose is at the moment, and I think it can only get better from here. So I'm not gonna complain anymore about it. Unless I feel ranty or something, then that's a different story. Anyway, I had I tried to have bread today, like patty, like hamburger patties, and it was okay. And subsequently, I tried to have a bit of salad leaf, and chew it in normal speed, and that was okay. It was all okay until I tried to drink a bowl of soup that is quite thick because it's like, cornstarch in it. And I drank a bit too fast and a bit too much, and I suddenly sort of heard a lot of clicking noises. I've already asked my surgeon, and he already said that, you know what, the clicking is just wearing out of the muscles and it's completely normal, so just no worries about it. But even then, it's scary, And although I know now my condition seems fine, but when today I tried to run for the train. I haven't taken public transportation besides a cab, which I don't think is considered public transportation. It's just a car. But besides my parents' car, I have only been taking taxis and cabs, and I haven't taken public transportation. And today was my first day trying to do it for like 10 minutes because it's just 2 stops. And I was running for the train, and when I started running, I felt the screwed up area sort of hurting, like the like it's sort of it's more like a numb prick, it's like you feel when you feel you know when you sort of have your legs in the air for too long and you sort of and it starts feeling numb, and that's sort of a prickly feeling. That's how it feels, except a bit more painful than that. Okay, so as of now, I'm not in the condition to do any sports, any running, any squeezing with crowds. It's just I can't do it. Okay. My swelling is still quite obvious. Okay, especially on my right. I don't know why. I think it's because the muscle was inflamed here more, and that's why it's taking a bit longer to heal. One thing though is that my right, at first, it was sort of like that, right, on my right, because the prediction of the molds wasn't that accurate. Now, with the bands, look, the lower and upper teeth, they're aligned. So what the dentist was trying to do was to make, instead of an open bite here, he's trying to close it. She closed it, and by right, your top 2 teeth should be aligned with your bottom 2 teeth, and they're now aligned. So I have a good bite, and I'm quite glad because despite that good bite, because previously before surgery I had sort of a slanted face, my smile was like wider on this side, and it was really weird. But now, like, my chin's in line. Apparently, to see whether your chin is in line with your face is sort of just to see this middle line, which is where your nose bridge is, like that. And my chin is aligned, so that's good. And my bite is aligned as well. Now I'm just hoping that the swelling goes. When the swelling goes, I have like a symmetrical jawline, if you will. And yeah, so that's all I want to say. Oh, I was thinking about my nose, and the way I got over the situation to all jaw surgery patients is that I don't think you should go into the surgery like how I did, which is I'll go for the surgery if I need a rhinoplasty, I'll do it later on. I think you should go into surgery to begin with a mindset that um your new face will not look good with your old nose, because if you're gonna bring this forward and your nose is still at the angle that it was and really flat like that, it doesn't match, as you can see. Okay, like that. I know I'm pressing it so it looks even worse, but you know, it um I wouldn't say it wouldn't look good necessarily if you already have a perfect nose, then yeah. But you need to expect some changes. Like, my surgeon assured me that my nose didn't move, you know, because of the way he did it. It's just not meant to move, except, you know, a need for cinching. He didn't even warn me about the tilting of the nose, because to him, as long as the angle remains there, then it didn't tilt. And the angle is there, so I'm not gonna rebuke that. Although it is a slightly wider angle than what I had previously, which is almost an exact right angle. But to me, if doing a rhinoplasty later on, it doesn't fulfill too much of a satisfaction, of a purpose to make me more satisfied. Like, you know, on a scale of 1 to 10, I'll only be more satisfied if I did it. I'll only be like, on a scale of 1 to 10, it's only like a 3. It'll make me happier by that amount. Then it's not really worth it. Because, as I said pre-surgery in one of my videos, that this isn't plastic surgery. And whether or not you want to do plastic surgery, you need to think about whether or not the amount of satisfaction it gives you is enough for you to go take the risk. Yeah, especially for noses, where like I know how they're gonna do it, which is basically I met my Canadian friend today, and she just came back, and she's, you know, mixed Indian with some Chinese and Canadian blood, so she has a nose that is really extended here like that. Okay, it's really, really sharp. And she said that recently a lot of people have been asking her if she's done a nose job, which she hasn't. And actually, being able to see her made me make an even more informed choice about doing a rhinoplasty or not, because I know that the Dr. Ivor Lim, who's the one who will do my rhinoplasty if I do need one, he said that he's gonna extend the tip. You know, instead of cinching even more, he'll extend the tip. And when you do extend the tip, your nostrils will stretch upwards and become smaller like that, and your nose will go downwards. Okay, if you get my point. And to me, I don't mind you making the tip sharper, but I mind having my nose longer, because to me, if it's any longer, it's just gonna look really weird. So that was something for me to think about as well. Yeah, I'm still hearing clicking, by the way. What else do I want to say? Oh, I haven't been putting foundation on my face because I don't know. To me, it's like if it's swollen, I don't really want to put anything on it. And what else? Swelling. I've talked about that. Rhinoplasty. I've talked about that. Eating wise, I'm improving. Like, I can eat bigger pieces of fish and, you know, hamburger patties, like I said. Um, I still feel quite bloated and fat. Don't know why. And oh, my bowel movement is getting a bit lesser, but I think it's because I keep forgetting to you know, dissolve my fiber gel. This is my fault, I guess. What else? I wanted to say something. I don't know what I wanted to say now. I really wanted to say something, like make like a significant point. Maybe I'll just leave that for later on. Yeah, I think I'll leave that for later. So that's all I want to say. If there's anything, I'll just add it on to like tomorrow's video or something. Yeah, so I'll talk to you guys soon. I'm still trying to think of. There's definitely something I wanted to say. Oh, I don't know. On a side note, my friend saw me today. You know, people who haven't seen me for a really long time, even pre-surgery, and they saw me and they were like, "You look so much like, you look less fierce," and and stuff like that. And, like, in general, they made me quite happy with the way I'm looking now because, like, it's a positive change apparently, according to them. And yeah, I still have a double chin here, by the way. It's because of the swelling. Anyway, okay, if I do think of anything, I'll let you guys know. Talk to you guys soon. Bye.